Bismillah ar-Rahman ar-Rahim. I'm Dr. Mohibullah Wazir, and the topic is the common peroneal nerve or common fibular nerve. Note: the common peroneal nerve is the branch of the sciatic nerve with the root value of L45, S1 and 2, but the dorsal division of the ventral revive of L45 and S1 and 2. Follow the course of the common peroneal nerve. This is the sciatic nerve, which in the upper part of a peroneal fossa divide into tibial and the common peroneal nerve. The common peroneal nerve passes laterally and it lies just medial to the tendon of the biceps muscle. It lies in the compartment in the popliteal fossa with the relation that most medially is the popliteal artery, then is the popliteal vein, and then is the tibial nerve, and then laterally is the common peroneal nerve, and then is the tendon of the biceps femoris muscle. And then this common peroneal nerve then passes laterally to the lateral side of the fibula, to the lateral side of the neck of the fibula. Note the part. And over here at the lateral side of the neck of the fibula, on the lateral side, over here lies the lateral muscles, that is the peroneus longus and peroneus brevis. Over here deep to this peroneus longus muscle, and this is the head of the fibula, and at the neck of the fibula deep to this peroneus longus muscle, it divides into its two terminal branches, and you can see it over here. Look, this is the common peroneal nerve, and this is the tendon of the biceps, and then over here this is the peroneus longus muscle, and you can see over here it divides into its two terminal branches. Look, this is the anterior branch which comes into the anterior compartment and is called as the deep peroneal nerve, and it should be called as anterior tibial. And then this one which passes to the lateral compartment or peroneal compartment, that is called a superficial compartment, so superficial peroneal. And in this way two terminal branches, deep peroneal and superficial peroneal. These are the two terminal branches of the common peroneal nerve. Now what are the branches of the common peroneal nerve? Note, because look, the common peroneal nerve have a very short course. It extends from the upper part of the popliteal fossa and reach to the lower part of the popliteal fossa, and overhead divides into its terminal branches. And its branches are branches to the knee joint, and branches to the knee joint are, look, the upper lateral or superior lateral genicular and inferior lateral genicular, and from the lowest part one branch ascends upward, that is called the recurrent genicular. In this way three articular branches are being given to the knee joint as well as to the superior tibiofibular joint, that is superior lateral genicular, inferior lateral genicular and recurrent genicular. And there are two cutaneous branches as well, and the two cutaneous branches are, look, you already know, one is this sural communicating branch. This sural communicating branch, which is also called as lateral sural cutaneous nerve, and this joins the medial sural cutaneous nerve, which is a branch of tibial nerve, the two joints, and supplies the lower lateral part of the skin of the leg. And then another cutaneous branch, that is the lateral cutaneous nerve of the calf, and this lateral cutaneous nerve of the calf, it supplies the skin of lower lateral part of the leg. the skin of lower lateral part of the leg, lower two-thirds of lateral part of the leg, that is supplied by the lateral cutaneous nerve of the calf. And one muscular branch may be given by this peroneal nerve to the short head of the biceps. Otherwise, this common peroneal nerve do not give any muscular branch. Okay, and then of course through its terminal branches, that is the deep and superficial peroneal nerve, the common peroneal nerve, then through its terminal branches it supplies the anterior compartment of the leg, this whole of the anterior compartment of the leg, as well as the lateral compartment of the leg, and then also it supplies the extensor digitorum brevis, and then it supplies the first two dorsolateral ossei muscle and the skin between the two digits, that is the big toe and second toe, the skin between the two digits. In this way, this supply below this, it is by terminal branches, not directly, but direct branches are all cutaneous and genicular, but one branch may be, that is to the short head of bicep. Thank you very much.